It's my pleasure to introduce you to Paula Gramley. Paula serves with the as the Community Benefit Program Manager with Memorial Health Systems, where she oversees Sangamon County Community Health Needs Assessment. I'll hand it over to Paula.
Thank you. Can you all hear me? Is that microphone adjusted okay? All right. So Tracy gave an introduction into some of the work that we've been doing, and I want to, my goal today is to just talk about some available data that you might be able to use. I'm hoping that at the end of the session you will have found at least one tool that you can use with your own programs or projects. So I'm going to go through some introductory material, and then Tracy talked about the Enos Park Collaborative, and I'm from the hospital. So is everything I'm going to talk about just for health? Because when we started, I saw a lot of you are not from health, necessarily traditional health-related definitions of organizations. No, everything will not be about health, but actually we're going to talk about how everything starts to connect back and overlap. I'm going to introduce some data resources that are available online, and then I'm going to do a short demo of a data resource that we have on the Memorial website. How many of you are here from Sangamon, Christian, Logan, or Morgan counties? Okay, so this will be more relevant to you, but I'm hoping there'll be some things in this data set that you might look at and say, well, gee, maybe there's something I should go in and look. And even if I don't have this for my county, I could say, where did they find that information for their county, and maybe I could go find it. Or you can go back to your community and ask your hospitals if they have the same data set. It is a subscription service, and so I'll explain a little more about that. Then I want to have a discussion about, at the end, about what other data resources do you know. I want to give you a chance to give some feedback. So if something pops into your head while I'm talking, you can jot it down. And we will talk at the end about, because I certainly don't know everything, this is what I have just used myself. So I just want to start with an introduction to Memorial Health System. Our mission is to improve the health of the people in the communities we serve. We have 4 community-based nonprofit hospitals. Memorial Medical Center here in Springfield is a 500-bed tertiary hospital, and it is our largest hospital. We have Abraham Lincoln Memorial in Lincoln and Taylorville Memorial in Taylorville. They are both critical access hospitals, 25 beds. And then Passavant Area Hospital in Jacksonville is also rural, but it has 100 beds, so it is not a critical access hospital. To the other side? Okay. So also part of the health system is Memorial Physician Services, Memorial Behavioral Health, Memorial Home Services, which is home health and hospice. We have more than 7,000 employees. My role in the organization is to track community benefit. Not-for-profit hospitals have to report in detail to the Internal Revenue Service what we give back to the community that qualifies us for our not-for-profit hospital exemption. In the last fiscal year 17, we've just wrapped 18, so we don't have the numbers yet. Fiscal year 17, as a health system, we gave back $153 million plus back to the community. So that's part of my role. The other big thing I do is the Community Health Needs Assessment. As Tracy said, the IRS has required those every 3 years for nonprofit hospitals. So we did a needs assessment in 2012. And in 2015 and 2018, Memorial and HSHS St. John's collaborated with the Department of Public Health to do one needs assessment for the county. We had to call a lot of the same people to the table for the needs assessment, so this saved us some time and work and energy. So even though I am up here talking as Memorial, I want you to know that this needs assessment was very collaborative with St. John's and with the County Health Department. We all worked in tandem on all of this work, and we are right now completing the final steps of the 2018 Community Health Needs Assessment. We've identified our final priorities, so for the next 3 years, Memorial will be focusing on access to care, mental health, substance abuse, and mother-infant health. St. John's has selected their priorities, and the Sangamon County Department of Public Health is in process of finalizing theirs. And I'm working on our implementation strategy. So that is where we are at right now. This is a flyer from the joint community survey that we did this past year as part of the needs assessment process. Another unique thing that came out of this was, this may look like it's simple, but for two competing hospitals who compete very heavily to decide to collaborate was a big step for us. And for us to take this next step and say, we not only collaborated, we're going to work together on something, and we're going to work on access to care, and what does that mean? Well, let's do it in one neighborhood, and we did it in Enos Park. That's how this all came about. It wasn't planned from the outset of the community health needs assessment, we're going to have something in a neighborhood. It just kind of rolled along as we did our process. But that collaboration has been groundbreaking for us, and the community, I think, has appreciated seeing the hospitals work together. So what makes a community or an individual healthy? Hospitals are constantly being challenged to look outside the walls of the hospital. We have traditionally defined health as what we do, usually when within the walls, when people come to us. But when doing the community health needs assessment, we have to look at a lot of other health indicators. We have to look beyond cancer, heart disease, and diabetes, which would be traditional indicators of what hospitals or physician offices might be defining as health. So Tracy talked about the social determinants of health, and I wanted to bring this back again. This person, that 20% at the bottom, that little green part, that's where healthcare organizations have traditionally focused. But there is so much more that goes into making a community healthy and an individual healthy, and this is where it impacts the work a lot of you are doing that are outside of healthcare organizations. So there are healthy behaviors like tobacco use, diet and exercise, alcohol use, sexual activity, the physical environment, the air pollution, is a community walkable, are there parks, is it safe? And then the socioeconomic factors is 40% of community health, and that's education and employment, family and social structure, income, and community safety. So all these things overlap. So when I'm talking about health today, I'm talking about it as this bigger picture, and I will be talking about some health indicators, but a lot of these other indicators underlie all of that information. So when we did our community health needs assessment, we consulted lots of secondary data, and it's information that was collected by someone outside of the hospitals. It was already existing data. So we looked at a lot of resources, and I'm going to touch on some of those today. And the most significant one is the Healthy Communities Institute data for our 4 counties that we have, but we had a lot of other resources. And then we collected primary data. There was more information we needed to know. So we had a community advisory committee consisting of 13 organizations. Some of the people that participated in that committee are here today with us. We did an online survey conducted by UIS Survey Research. We took all of the outcomes and the recommendations from the community advisory committee back to an internal advisory committee, and we said, how does this line up with where the hospital is and where our strategic plan is going and these types of things. We decided to continue work that we had started in Enos and to expand to another neighborhood. So that program is continuing now into another 3 years. So we held neighborhood focus groups in our new neighborhood. We had 4 focus groups, and we worked with seniors, younger adults, parents, and stakeholders. And again, UIS Survey Research did those focus groups for us. And then we also had a couple places where we needed more information. We needed some help to clarify some of the data we had. So we sought out a content expert, and I'll explain how we did that in a little bit. So when we're starting to look at data, one of the first things I need you to think about is, where is it coming from? How was it acquired? What organization got it, and how did they do it? So one example I want to pull out is BRFIS. It's Behavioral Risk Factor Surveillance. So this is a health-related telephone survey that's collected across the United States. Here in Illinois, the Illinois Department of Public Health does it. And it concerns a phone survey with questions on people's risk factors, how they view the chronic health. Have they been diagnosed with diabetes? Have they had certain things? And do they use preventive services? Have they had a mammogram? Have they done this or that? What, smoking? exercise. So these are really good indicators, and over a period of years, you can get a pretty good snapshot of a community. But I want you to remember, so when you look at what's the source of data, this is a phone survey. So if you're looking at an obesity rate that's coming from a phone survey, you have to remember this is a question an individual answered to a phone surveyor. This isn't information that was pulled from all the doctor's offices of all of their patients, and you got an obesity rate from clinicians. So I'm not saying that the BRFIS is not good, but we need to remember sometimes the source of the information. So if you were saying our obesity rate is 12.5%, well, it was on the basis of phone survey. If we had physician measures, which we don't, we can't pull those things out from multiple physician records, but that measurement might look different. But it still is an indicator overall that of a measure. So I think you should look at how frequently is the data collected. Some information is over a rolling period. So it may be a period that they have to accumulate the data, and then they add another year or two of data on, they roll it up. So it may not be something that's collected every year. Sometimes the information is lagging way behind when you think you want to look at it. So for 2018 Community Health Needs Assessment, we had some indicators that the data came from 2007 to 2009. That's pretty old to start looking back. So you want to look at, you know, what's the time period measurement, and how frequently is it measured. And then you want to be careful about selecting measures that aren't updated frequently if you're going to pick one for evaluation. So it may take years to show an impact on a really large measure. So you may have a statewide or county measure, or something that you think you want to impact, but the measurement period may be far behind. It may be 10 years into the future until you can start to see where some of that information came from. And then it may be also possible to improve that your intervention impacted it. So, you know, there could have been a lot of other things that made something go up or down. So I think this will help drive some direction for you, but be careful about picking some of those big things to say, we're going to impact the lung cancer rate. It may take years and years, and generations of smokers are going to have to go through their health before you have that. So think about what you want to say you impact. Maybe you want to impact smoking rate among teens, and you can find another measure to do that. In rural communities, some of the data from a smaller population is sometimes suppressed. There may be a few, for example, mental health measures that in a very small population, when you do the statistical measures, may bump it up and make it seem like it's a huge issue, where it may just be really a small issue with a small number of people. So sometimes some of the measures you get for an urban area are not the same as what a rural area is able to demonstrate. And a lot of times that's those rolling periods. They have to roll the periods over to get enough data to collect for some of the smaller populations. A lot of times too much data can make it challenging to narrow in. So an example of this was I have cancer indicators for our county. I have lots of cancer indicators for our county. A lot of the cancer indicators were not very good for the county. So we didn't want to just put as a priority on the needs assessment, should we look at cancer? Well, what type of cancer? What's most significant? So I went to a content expert at our hospital who is very well versed in cancer research, and she looked at all the data with me, and then she took a little deeper dive and went back into actual numbers of people impacted. And so she brought up a cancer. She said, this would not be a particularly good cancer to say is a priority. It may look like, by percentage-wise, like, boy, we have a lot of it. But she said, I looked at it, and it's only impacted 43 people in the county. So that's 43, whereas she said lung cancer has impacted over 400 people in the county. And if you want to look at something to have an intervention on, you may have a better chance of intervening on that, whereas this cancer over here has very few things that you could do on the outside to intervene with the process of the cancer. So, you know, just kind of take a look at some of those things and try to weigh out. So you may need to dig a little deeper. Another example was infant mortality. Infant mortality for Sangamon County has not been good for a number of years. It has improved, but we are still above what is the recommended average. And I know during the 2015 needs assessment, we had to find out, well, the definition of infant mortality was deaths from 0 to 12 months. At just the purpose of looking at infant mortality, I would think it would be the infants that died at birth or very shortly after birth. But it's not. It's that 0 to 12 months. So when we did the needs assessment this time, we looked at the data again. The data, there had been a little bit of improvement from where it was several years ago, but we still didn't know what are the causes of those deaths. Is it, SIDS? Is it child abuse? Is it this or that? So we went to the county coroner and got information, and she pulled up some information, and she actually had to hand dig through the files and compile the information for us. But it was very, very revealing. We found out that the leading cause of infant mortality in our county is accidental asphyxiation, children accidentally smothering. Whereas we were probably assuming and applying resources to other things. The information the coroner gave us was very revealing. And as a consequence, we have mother-infant health as one of our final priorities that we're going to be looking at. You want to be careful some of these requests that you make. These are very busy people, and a lot of this data isn't in a data that, there's data, but they can't sort it and pull it out like that. And if they have to go in and hand pull out some of this information, so you may really want it, but make sure it's information you really want or need. Make those requests wisely because you've got busy people, and make sure it's something that could impact a decision or that could underline a policy for you. So I'm going to start in now with talking about a few of the data resources. Then I'm going to show you a demo on our website of some of the data that we have. And then we're going to jump back into the handout that's in your folder, and we'll talk about a few more resources. And then at the end, I want to get input from all of you about what else you know about. So the first one I want to talk about is county health rankings and roadmaps. Has anybody in here ever used county health rankings and roadmaps? Okay. There's not very many of you. This is available for every county in the United States. So this doesn't, regardless of which part of Illinois or another state you're coming from, you can get information. They provide a snapshot of how health is being influenced by where we live, work and play and learn, those social determinants. And it can be a starting point. They have values for 35 measures. And some measures are small and suppressed to protect the privacy. Like I said, sometimes in a rural area it can be such a small measure that they can't include it. But they do work with that. They statistically do the analysis. They also include trend graphs. So for 17 of the measures, you could see there's a little button you can click and you can see, are we getting worse or better? So that could be an interesting thing on your data. You can compare your county to other counties. So if you want to know how you're doing in comparison to somebody else. And this is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. So this is an example of what you can get. This is updated every year in March. So this is all of the counties in Illinois. And if you're ranked number 1, you're the best. Number 2, or 102 is the worst. So I've got Sangamon County circled there, and they measure on 2 areas. There are the health outcomes, which is the green area, and that's length of life and quality of life. And we're not doing quite so hot here. We're in the bottom quartile there, just about for our county. Now, the blue, we are 26 out of 102 counties for health factors. And this includes health behaviors, clinical care, social and economic factors, and physical environment. One of the main reasons we are at number 26 is because our clinical care typically ranks in the top 3 or so of the state. So we have good hospitals, a lot of doctors, a lot of resources in this county that other counties downstate don't have. So those resources and the quality of the care can bump up our ranking. Another thing I want to tell you is that some of these measures are the BRFIS measures that the Illinois Department of Public Health does. And my understanding is that they do the BRFIS surveys for counties on a rolling 4-year basis. So you may or may not have a change in some of those measures, depending on whether or not your county got surveyed. Conversely, your county may get bumped up or down, and maybe you weren't surveyed at all, but other counties changed their rank. So your county could have, changed its location on the ranking, and you may not have changed anything actually. So it's relative to the other counties. But I will say, like, we're at number 75 for health outcomes, and we're not going to suddenly jump to number 10. We're not going to suddenly take a leap like that. We might jump to maybe 68, we might go to 79, and that might be based on some other factors. So overall, this is that snapshot. It kind of just gives you a picture of where your county is. So it's not just a map. You can run a report on your county, and you can highlight things that you're doing well and things that may need improvement. They will highlight those things for you. There's some little squiggle boxes that show trend lines. You can click on each of these things and find out more about your county. So you can dig further, and then sometimes off of that you can dig a little further. So there's some information in this website that's really helpful. They also have a lot of other information. So there's a take action to improve health. How do you start to work with others? How can you start to bring these conversations to the forefront? What works? So evidence-based policies and programs. So you want to create a policy on truancy. Could you go here and see if there's something else that somebody else is doing that is, related to that it's been evidence-based and they've had good results? There's an action center. It includes a lot of guidance and tools for working and engaging with partners, a lot of information there. And then learn from others. This has been in existence since 2010, and they offer free webinars. So there's a lot of information in those webinars. So all of this site is free, everything here. So Tracy also mentioned, place matters, so county, but can we get down, is it all the same across the county? No, it's not. So your zip code can matter. So Tracy referenced this map before, and I'm going to show you where you can get this. If you're in the 4 counties where we have our hospitals, it's on our website, and you can do additional research on that. So these are the 3 zip codes that with the highest risk in our county. And by highest risk, they're correlated with preventable hospitalizations and premature death. So these are counties, or the zip codes, 03, 01, and 02. And they're all on the north and east side of Springfield. And these are things where those social determinants of health come in. So the number of people in poverty, the number of children in poverty, the number of single-parent families, the high school graduation rates, all of those things factor into this. So this isn't based on diabetes or cancer or anything. But what it's telling us is that people who live in these zip codes, because of all of those social determinants of health, are at higher risk for hospitalizations that might have been avoided or for premature death. So here's an example. So, and I'm sorry that the program cut off the zip code there, but I've got them lined up. So zip code 62711, people going to the emergency department due to diabetes. So 62711, I'll just go back here. 62711 is our best zip code ranking. So I've got the worst here, but 62711 comes out with the best ranking of all the zip codes in the county. So I looked up what is the ER rate for diabetes, people going to the emergency department for diabetes. Their diabetes is out of control, they may not have their medication, they may not be seeing a physician, they may not have access to healthy food. So you can see here the dials in this information tells us what quartile you fall in. And compared to all the other zip codes in Illinois, 62711 is in that green quartile. They're actually in about almost the top 25% of counties. So here's 62702. This is our 3rd worst ranked zip code. I put this in here because Pillsbury Mills and Enos are in this zip code. And I'm going to be talking about Pillsbury Mills a little bit. You can see, look how many more people, how many events, diabetes events, driving people to the emergency department from that zip code. So here's asthma. On the left, we have 62711. Asthma rate is in the green. 62702, asthma rate is all the way over to the right. And these are people that live just a few miles away from each other. So here's a couple more. 62711, pediatric mental health visits to the emergency department. They're in the green. 62702, pediatric mental health visits are on the far right. Compared to all other counties or all other Illinois zip codes, they're among the worst. So the ER rate due to alcohol abuse, zip code 62711 is in the green, and again 62702 is in the red. So place matters. Beyond place, just that zip code, your neighborhood can matter. So the Enos Park Access to Care Collaborative, as we're starting our next 3 years of work with the 2 hospitals and SIU Medicine, we've changed the name to Access to Health Collaborative. Tracy wanted to say health and not just care, because we're really trying to improve health on those broad measures of socioeconomic determinants, and we're out of the Enos Park neighborhood. We're still there, but we're expanding. So we have a new name, and we have just started work in a new neighborhood, Pillsbury Mills, 62702, and then the neighborhood census tract ends with an 800, so I'll just call it 800. So if you look at the map here, you can see Enos Park is just directly to the east. And if you go across 9th Street, Pillsbury Mills starts right there. Now, I will say that this census tract actually extends a little farther south and goes all the way down to Clear Lake, but that is not within the neighborhood boundary. So the census tract is slightly bigger than this neighborhood, but the neighborhood statistics hold for this census tract. The photographs over here are the old Pillsbury Mills. That's where the neighborhood got this name. If you see on the map, you can see there's a line going up on the far right of the neighborhood. It says North 10th Street. That's the 10th Street Railroad corridor that's being turned into high-speed railroad. And then on the upper right side of this neighborhood, you see all these railroad tracks coming in. That's the old Pillsbury Mills. It's abandoned. It is in partially torn down condition. It has very high danger for asbestos and lung and disease hazards. It's been a cleanup site. It's not yet cleaned up. There are a lot of issues with this neighborhood. And so we have some other things going on in this neighborhood as well. One thing we do not have that we had in Enos Park is we do not have very many services in the neighborhood. We have 2 churches that we have identified. I think there may be a bar, there may be a hairstyling salon, there's no other businesses. The only social service agency is Second Chances, and it operates out of one of those 2 churches. So we do not have the resources in that neighborhood that we had in Enos. The neighborhood association is much weaker than what we had in Enos. Enos had a very sophisticated neighborhood association with a long track record of working together. This is a group of a couple of seniors who are landowners who want the mill brought down and who don't like the conditions of the rental property. 22% of the people are homeowners, the rest are renters. So we have a lot of things. This is going to be a much more slower process and much more uphill battle as we start to work in this neighborhood, build trust, get to know the neighbors. We just had our first meeting with them on October 3rd. We had our very first meeting, but we come back now. We did some focus groups, and we've come back, and we had our first meeting on October 3rd. So here's some information I just wanted to briefly show you. So those health indicators I have, like diabetes and asthma and some of those things, I don't have those down to the census tract area, but what we do have down to the census tract area is some of the economic measures. So here's some economic measures. So our best zip code, children below poverty, is 1%. And then for the zip code 62702, where Enos and Pillsbury are located, it's 45.5% of the children are in poverty. Let's move over to Pillsbury Mills. Within that neighborhood census tract, 69.6%. So if I'm only looking at zip code and I don't get down onto the neighborhood level, I may be missing some things. The single parent households, 10.5% in 62711, 57.4% in 62702, 88.4% of the children in Pillsbury Mills are in single parent households. So there are other indicators, but that just gives you an idea of how, if you dig a little deeper, you can find out maybe a little more about the area where you're working. The Centers for Disease Control, Robert Woods Johnson, has 500 Cities project. It came out in 2017. Has anybody used this? A couple of you. Okay, so they have taken the largest 500 cities in the United States, and they're providing city-level data and census tract data. So you can get it for your city, not for the county, for the city, and then for those neighborhoods. And it's giving you estimates for chronic disease risk factors, health outcomes, and clinical preventive services. And you can set it up and run reports and compare your city with other cities. We have 18 Illinois cities that are included in this, so I'm not going to read those to you. I'll give you a second to look at them. So if you are from one of those cities, you can go to the 500 Cities Project and look for data. So I'm just going to show you two. This is adult mental health days were said that they were not good. This is BRFIS data from the phone survey, but this is the map of Springfield with all the census tracts, and I have circled there in red the 800 census tract, which is Pillsbury Mills. And you can see it's in one of the darkest colors, so the indicators there for health not good for adult mental health is high. It backs up some of the ED mental health statistics and things that we have for the zip code. So here's another one, asthma, adult asthma. And it's broken out by all the census tracts, and so you can start to see which areas of your city have better health indicators than other. So this is a brand new program. This is called the USA LEAP, and I have just heard about this. It was released in September, and this is public health outcome measures for the nation at the census tract level, and it's measuring life expectancy at the census tract or neighborhood level for almost every neighborhood in the United States. So you can get into this, and what it shows is that where you live matters, and not everybody has equal opportunity to be healthy where they live. So you can go to this website, you can type in your street address, and it gives you the average life expectancy for people in your neighborhood. For a baby born in your neighborhood, what do they think, how long will the life be? So this could help you identify, areas for priority funding, in neighborhoods that need more investment. This is from the Robert Wood Johnson and a number of other associations, including the CDC. So I just did a quick look at this. So I plugged in an address at random. I found an address in Pillsbury Mills. Their years of life expectancy are 72.8. The county average is 78.33. I found an address in zip code 62711 and it is 84.4. So we have a difference of 11.6 years of life expectancy within the same city with zip codes that are really not very far apart. So this may be some information that you might be able to apply to some of your work. Community Commons. Has anybody used Community Commons? Okay. So there is a lot of information and tools at Community Commons, and it's a free resource, but you have to register to use it. And I saw something on their website, so I emailed them when I was getting ready for this presentation because it said the use of the maps was free through the end of 2018. So I emailed and I said, are the maps going to be free going forward? And they said some of the services on this will become subscription. My guess is it will be some of this mapping stuff, but you have an opportunity to get in here, define what you want to map in your geographic area. So it may be issues with food, it may be issues with education, just a lot of different things, but you can build your own maps in this site. So if you want to try it out, you might want to try it out what's free. And a lot of the resources will remain free and available. So I have not used this one a great deal because I have had other tools available to me, but I would recommend that you take a look at this and see if there's something there you can use. The CDC has a lot of information, so these are two places you might want to look. Community Health in Action. It's a lot about doing community health work, and again, health and that social determinants. So you're looking at that big picture of health. So there's a lot of resources. And then there's a lot of talk about, using best practices or evidence-based. And the CDC maintains a database of interventions that they have vetted and that they have said work in these 4 areas for socioeconomic factors, physical environment, health behaviors, and clinical care. So you may want to check out that if you're at the point of saying, well, I've got a need identified, but I'm not sure how I want to address it. So there's some resources there. And then just before we go to the website, I'm going to show you a community toolbox. Does anybody use this one? This is from the University of Kansas, and there are a ton of resources on here. This one is not so much data, but about how to do things and giving you the tools to do things. So it can help you with needs assessments and resources and how to address social determinants of health, how to engage stakeholders, how to start to get people around the table, action planning, building leadership, improving cultural competency, planning and evaluation, sustaining your efforts over time. So there are a lot of things. So there's some things in here that you might not see typically somewhere else. There's a project in here called Photo Voice. We're going to do something similar to Photo Voice, so we're adapting that for the Pillsbury Mills neighborhood. We're going to send out neighborhood volunteers with cameras and ask them to take pictures in Pillsbury Mills of things that help them be healthy and things that do not help them to be healthy, and do a photo assessment of them telling us what they see in their own neighborhood. So that is just one of dozens of things that are in this community toolbox. So if you're looking for ways to do things, if you're looking for information about focus groups, if you're looking for information about bringing a group together, but then how do you narrow down your priorities? How do you do that? If you have a person in your group that's very vocal and drives the process and everybody else sits at the table and doesn't say anything, what's a tool that you could use to get whole group engagement and things? There's just a lot of resources here. So here's my hint from using this or trying to use it. Mark it. If you see something you like, write down where you found it, because the resource is large and it's hard to go back and find it again. So if you think you might want to refer back to it, make note of where it was. So I'm going to switch over now to our Healthy Communities Institute on our website. So as I said, this is for the 4 counties where we have hospitals, but you might be able to find some use for it in your own work. So on the handout I gave you, I've got the website listed. I'm also going to show you how to find it. It is on the bottom of our hospital webpage. And if you forget where else to go, you can go to the memorial, and it's down here on Healthy Communities. It's also under Community Health Need Assessment, but this, I think, is the quickest way for you to find it if you don't want to plug in the website. So what we have here at the top is our Community Health Needs Assessment. This is our 4 hospitals. This is the detailed report on what we just did for our 2018 needs assessment. By November 30th, we will be adding another box here, and it will include our implementation strategy. So if you're curious about what we did, how we did it, why we did it, it's there. And then the rest of this, I have some information on Enos Park, the collaborative, the impact statements are there. Our 2015 work is there. But down here is the community dashboard. So before I go to there, I'm going to switch over right here to Community Snapshot. That drops all that community health needs assessment stuff off the top and lets me come in and just look at this data. So I'm going to just spend a couple of minutes showing you a few of the things here, and then we'll have some discussion. So this is the map of our 4 counties where we have these zip code level data. So we have Morgan, Logan, Christian, and Springfield, Sangamon. So you can zero in and narrow your selection to 1 county. I can compare all 4 counties, and it ranks them up from best to worst and gives me that ranking. And if you want a little bit more information, say, what was it that you said that was measuring? There's a box here. Oh, there it goes, how it works. Okay, so it pops up down here, and it tells you a little bit more about how the things that have gone into configuring those ranks. So I just wanted to show you where that lived So if you're interested in using that tool, you can find it. If you are from another area, you may want to check with your hospital to see if they have a contract for this service, because this is a paid service. One of the nice things about this service, I'm going to be getting in and showing you some data very quickly, is that they automatically update it. So when something is updated from the CDC or the National Cancer Institute or something else, it gets populated and updated into here. So I don't have to worry about that. I don't control this data. It was somewhere else. So we have well over 100 indicators for each of the 4 counties. And I'm going to show you here that we have the 4 counties listed. You can also look by every zip code in those 4 counties. And I'm going to scoot on down here, and you can get into your census tract. So the health indicators are not by census tract, but a lot of those socioeconomic indicators are by census tract. So here we're in Sangamon County, and I'm just very quickly, we have access to health services, cancer rates. People tell me they get dizzy when I do this too fast. I just want to hit, though, what the categories are. Diabetes, health disabilities, exercise, nutrition, and weight, family planning, that's teen births, heart disease and stroke indicators, immunizations and infectious diseases. So that's your pneumonia and hepatitis, chlamydia and gonorrhea. These are extremely high. I'm going to stop here and take a look at one of these. So let's just look at the chlamydia rate. So when you click on an indicator, it tells you selected Sangamon. You can change it if you want to look at another indicator. It tells you what the measurement period was. It tells you why this is important, and you can click here and get a little more information. And you come here, so it's telling me again it was Sangamon County. It's telling me what our numbers are. It's telling me the source. So this is where the information came from. The measurement period was 2016, and the last update was October 2018. So this measurement was recently released and updated from the national site, so we were able, this organization that we contract with updated the information. So we have, compared to all other counties in Illinois, Sangamon County is in the worst quartile, and against all other counties in the United States. And our values have gone up, gotten worse. Our trend is kind of up and down, and this is against the 4 other counties. And then what are some related information? So what else in this data set might be related to these indicators? So you can click on this and find out maybe it's teen births, maybe it's HIV, gonorrhea is in there. So you can see what else is in this data set to do that. So I just wanted to show you, I'm only going to click on one indicator because I just wanted to show you the types of things that are in these. Health, nutrition, and weight, heart disease, stroke. So here's mental health indicators. That's where I got the pediatric visits to the emergency department for mental health. And those visits came from the hospital records. It's HIPAA compliant. We report up to the state, and then we contract to have that information drawn back out for these indicators. So there's just a lot of things. I'm going to go way down to the bottom here just because I want to show you, you may not be aware of this, there's a page 2. So a lot of the socioeconomic indicators live over here on page 2. So we have your employment rates, the government assistance, home ownership, housing affordability, and economy and poverty, and those things. So if I ran a report on here, if I went back to page 1, and I ran a report, I've got the county indicators. So if I ran a report on 62711, almost all of these indicators are going to be in the green. If I run a report on 62702, the majority of the indicators are red or close to red. So the place matters with health outcomes. If you want to get, there's a lot more to this website. If you want more information, you can contact me, or you could attend that workshop on the 19th, and I'll be going through it a little more detail You'll have a computer in front of you. You can get on and play with the data itself. And here we have a legend here that tell what all the symbols mean. Some of the indicators also have disparities noted. So for some of them, we can see if there are disparities by race, gender, or ethnicity, or age. So not all of that information is available for all of the indicators, but they are for some of them. So what I'd like to do right now with the few minutes, yeah.
Before you move on, the data base that Memorial has provided access to, is that something other hospitals can contract with some entity to provide that in their communities? Is that something that...
This is a paid subscription with the organization called Healthy Communities Institute.
Healthy Communities Institute, okay.
Healthy Communities Institute, and it was acquired just a few years ago. It came out of Berkeley, California, the university there, and a lot of the health work that was there. The organization received a lot of national recognition for hospitals and communities. There are actually some communities that have this on a community basis and not just a hospital basis. So you can get more information there, but it is an annual subscription service that you have to pay.
So for those of you who are building collaborations and coalitions with your local healthcare systems, this might be something you might want to surface with those organizations.
Yeah, if you want to take a deeper look at this. So what I'd like to do now is I want to give you I'm going to say 2 to 3 minutes at your table. Would you share if you know of a resource that we haven't touched on? I want to refer back to the handout very quickly. I have a lot of other resources listed that I did not intend to go through, but they include Healthy People 2020, the U.S. Census Bureau, Illinois Department of Public Health, the State Health Improvement Plan. Illinois Youth Survey has some really good information and voices for Illinois Children Kids Count. And then right here in your local community, check to see what your community has. So here in Sangamon County, we have a citizen survey that is done every 2 years, and there's some really good information that comes out of the citizen survey. And UIS is involved with that, and that's a great resource. The Sangamon Success and Continuum of Learning is another locally based group that has been looking at issues to help less advantaged children. You could get information from there about what they have prioritized. Community action agencies are a great resource. Char's here. We've worked, she shared the Sangamon County Department of Community Resources Needs Assessment Plan with me, so we got information from that. Every county health department has to do an I-plan. Check with your local United Way. Have they done a needs assessment, or what are their funding priorities? Your local urban league, your Head Start may have done a needs assessment. Maybe there's something in your Chamber of Commerce. School report cards are available, and your Regional Office of Education Superintendent. So I want you, just 2 to 3 minutes, turn to the others at your table. Is there another resource that you're aware of that is helpful for community data that we haven't touched on? And then we're going to just pass the mics from table to table, and we'll just kind of see who's got something to share. So just take 2 to 3 minutes to discuss. Okay, we're going to get started, and we're going to start over here on this side, and Crystal's going to help pass the mic from table to table, and you're going to help pass over this way. So we'll start over on this side. I think we'll rotate, go back and forth. Do you have a resource that we haven't mentioned?
I do. 211 is that free service in our community and reports out on a quarterly basis what some of the highest needs and calls are for.
I wasn't aware they had a report that came out, so that's really good to know. Thank you. Anybody over here? They've got the mic.
Hello? Okay. So all of the federal public agencies, there's online, you can type in the agency .gov/open, right? And you can look at all of the information that they populate within their agency.
And those could be national, state, county, depending
just
on what
federal.
it is? Just federal? Okay.
Yeah, it was implemented by Obama.
Okay. Over here?
We use a lot of arrest reports and data from the police departments, and we actually have really good relationships with our police department, so if we're looking for something very specific, they'll usually generate their reports and send them to us. So, but they have to report annually on just certain demographics and statistics. So,
Okay, so that's an example of maybe you know crime's an issue, but you want to dig deeper, you go to your content experts and go to your local police department. Okay?
So Medicare just came out with a new mapping disparities map.
Okay.
It just came out, so you might want to Google that. And then I know the VA also has rich data.
Okay,
Yeah.
that's great.
I work with mostly criminal justice agencies, and so they do have some things available in the Illinois Criminal Justice Information Authority's website. ICJIA.gov, for those who don't know what that is. Tons of data on there for Illinois.
Okay, Illinois Criminal Justice
Information Authority.
Information. Okay, great.
For Girls on the Run, we use the, sorry, I had to cheat, National Center for Education Statistics. It has all the Title I information on there, but for demographic data or anything like that, we use Illinois Report Card instead of this.
Okay. Anybody else?
I don't know if this was mentioned already, but the Henry J. Kaiser Foundation
I don't know that.
is a website that uses state and national data.
Okay. Is it in one, just on one particular focus area, or just lots of data?
It has a
Health? Health.
Yes.
Okay. Somebody else back here?
Yeah, IDPH is mentioned with
I'm
data
sorry, we can't hear you.
statistics. Hello?
There,
Yeah.
go.
So under IDPH, we also have iQuery, which is an online database that provides more than 400 health indicators.
Okay, so it's called iQuery, right?
iQuery, yes.
iQuery, and it's on that IDPH website. I included the website link there, but you can get into that and do
okay.
additional digging.
Okay.
And we're going to get these available on the website so that you'll have this information.
Anybody else? Sean?
Our community action plan centers around poverty, so we use the Heartland Alliance report on Illinois poverty, and Sangamon County is on the watch list. We use the IDES employment report, the Continuum of Care Homeless Population Point in Time survey.
Okay.
We use 211, as John said. We use Mind the Meal Gap, which is a food desert map that you can inquire. We use the child care profile through the Community Connection Point, and we also use Sangamon County graduation rates, which you can query through the Illinois report card, and I think it's probably under State Board of Ed.
Okay.
Okay, thank you.
Anybody else?
You can also use factfinders.census.gov. They have information about population, income, etc. for all community at all levels, county, state, everything.
Okay, so the website again was
Factfinder.census.gov.
factfinder.central.gov. Okay. Anybody else?
I've always used city-data.com. It has a great summary of all the city data that it collects, and so there's a whole lot of things on there, including income, schools, health, all the agencies and things that they have reported there. So I've always found that as a good initial resource.
Anybody else? Thank you.